Most people think arthritis is just one condition, but that's not actually the case. Two of the most common types are osteoarthritis and rheumatoid arthritis, and although they can cause similar symptoms, they are very different conditions. Understanding the differences is extremely important because the treatment and the long-term outlook can be very different. I'm Dr. Bhadauria, consultant rheumatologist at Pure Rheumatology London, and in this video I'll explain how to tell the difference between osteoarthritis and rheumatoid arthritis, the key symptoms to look out for, and when you should consider seeing a specialist. Let's start with the basics. Osteoarthritis is often described as a wear and tear condition. It occurs when the cartilage within a joint gradually breaks down over time. This leads to pain, stiffness, and reduced movement. It's more common as we get older and often affects weight-bearing joints such as the knees and hips, although it can also affect the hands. Rheumatoid arthritis, on the other hand, is an autoimmune condition. This means the immune system mistakenly attacks the lining of the joints, causing inflammation. Over time, this inflammation can lead to joint damage if it is not treated properly. So although both conditions affect the joints, the underlying cause is completely different. Now let's look at the key differences in symptoms. One of the most important distinctions is morning stiffness. In osteoarthritis, stiffness is usually short-lived. You might feel a bit stiff when you wake up, but it typically improves within a few minutes once you start moving. In rheumatoid arthritis, the stiffness tends to last much longer, often more than 30 minutes and sometimes an hour or more. Patients often describe feeling very stiff in the morning and needing time before they can get going. That's a key red flag for inflammatory arthritis. Another important difference is the pattern of joint involvement. Osteoarthritis often affects individual joints and may not be symmetrical. For example, you might have pain in one knee or one hand. Rheumatoid arthritis, however, often affects multiple joints in a symmetrical pattern. This means both hands, both wrists, or both feet are affected in a similar way. This pattern is something we pay very close attention to in rheumatology. Swelling is another key feature. In osteoarthritis, swelling is usually mild and related to structural changes in the joint. In rheumatoid arthritis, swelling is due to active inflammation. It may be more pronounced and associated with warmth and tenderness. This type of swelling is something we take seriously because ongoing inflammation can lead to joint damage. Pain behaves differently in these two conditions as well. In osteoarthritis, pain tends to worsen with activity and improve with rest. For example, knee pain that gets worse when walking or climbing stairs. In rheumatoid arthritis, pain may be worse at rest or after periods of inactivity, and it often improves with gentle movement. This is another important clue that inflammation is involved. Fatigue is also a key difference. Osteoarthritis typically does not cause significant fatigue. Rheumatoid arthritis, however, is a systemic condition, which means it can affect the whole body. Many patients experience persistent fatigue, low energy, and a general feeling of being unwell. Age can also provide a clue, but it's not always definitive. Osteoarthritis is more common in older individuals. Rheumatoid arthritis can occur at almost any age, including in younger adults. So if someone in their 30s or 40s develops joint symptoms, we think more carefully about inflammatory causes. Another difference is how the joints look over time. Osteoarthritis in the hands often leads to bony enlargement of the joints, particularly at the ends of the fingers. Rheumatoid arthritis may lead to different types of joint changes, often involving the knuckles and wrists. Now, one of the biggest challenges is that early rheumatoid arthritis can sometimes be subtle. Symptoms may develop gradually, and it's easy to assume that the pain is due to something less serious. This is why recognizing the warning signs is so important. So when should you consider seeing a rheumatologist? You should consider specialist assessment if you have persistent joint pain lasting more than 6 weeks, more stiffness lasting more than 30 minutes, swelling in multiple joints, symptoms affecting both sides of the body, or unexplained fatigue alongside joint symptoms. These features raise concern for inflammatory arthritis and should not be ignored. Early diagnosis is absolutely key. In rheumatoid arthritis, there is what we call a window of opportunity where early treatment can significantly improve outcomes and prevent long-term joint damage. The earlier treatment is started, the better the long-term results. So how do we confirm the diagnosis? The process involves a combination of clinical assessment and investigations. We take a detailed history, perform a joint examination, and may arrange blood tests to look for markers of inflammation or autoimmune disease. Imaging such as X-rays or ultrasound may also be used to assess the joints more closely. It's important to understand that there is no single test that gives the answer on its own. The diagnosis is based on the overall clinical picture. Let's briefly talk about treatment. Osteoarthritis treatment focuses on symptom management. This may include exercise and physiotherapy, pain relief, weight management, in some cases, joint injections. Rheumatoid arthritis treatment is different because we are targeting inflammation. This often involves disease-modifying medications such as methotrexate and, in some cases, biologic therapies. The aim is to control the disease, reduce inflammation, and prevent joint damage. These treatments have improved significantly over the years and can be very effective when started early. One of the most important things to remember is that not all joint pain is the same. Understanding the pattern of your symptoms can give valuable clues about the underlying cause. To summarize, the key differences between osteoarthritis and rheumatoid arthritis are: osteoarthritis is a wear and tear condition, while rheumatoid arthritis is an autoimmune disease. Osteoarthritis causes short-lived stiffness, whereas rheumatoid arthritis causes prolonged morning stiffness. Osteoarthritis may affect individual joints, while rheumatoid arthritis often affects multiple joints symmetrically. Osteoarthritis pain worsens with activity, while rheumatoid arthritis pain can improve with movement. Rheumatoid arthritis may also cause fatigue and systemic symptoms, which are not typical of osteoarthritis. If you're unsure which type of arthritis you may have, it's worth getting a specialist opinion. Early diagnosis can make a significant difference in managing symptoms and protecting your joints. If you found this video helpful, make sure to subscribe for more content on joint health and autoimmune disease. And if you're concerned about your symptoms and would like a specialist assessment, I see patients at Pure Rheumatology London. Details are in the description below. Thank you for watching.